Yeah, welcome back. This is Newsfile. It's your most authoritative news analysis platform. And here on Newsfile, we put Ghana first. My guest, Professor Darkwah, sociologist at the University of Ghana, Dr. Akoto-Ampao, Medical Director, Eastern Regional Hospital, Koforidua. He's chairman, Eastern Division of the Ghana Medical Association. He's member Coalition for Survivors of Domestic Violence. He's a public health specialist, epidemiologist, and healthcare management and leadership. Lamnatu Adam is executive director, Sungtaba, and Sungtaba means help one another or help each other. Chief Superintendent Osua Treme is director of DOFSU. Of course, we also have Professor Kwejo Apiajetia, who is at the School of Law, University of Ghana. So let's begin to get into the issues of solutions and how effective the solutions are. Now, Professor Darkwah, what do you know? Because you have done a lot of work in helping abused women, finding shelter for them, and the rest of it. What do you know to be the solutions that exist aside, using the law to punish violators? And how well are we doing in this country?
Okay, so there are a number of ways to think about how we address this. One is prevention, one is protection, right? On the issue of prevention, I really don't think we are doing anywhere near enough. We are burying our heads in the sand. Last year, there was a huge discussion in this country about comprehensive sexuality education. And we kicked against it on the assumption that if we talk about sex, the children will have sex. And then all hell will break loose. The fact of the matter is the sex is being had. So we need to have conversations with both our young men and our young women. Our children need to understand their bodies fully and understand the risks and dangers and be able to talk to adults in their lives when this is happening. If teachers have a comfortable environment that they set up in the classroom, a child can come up to you and say, if my father says this, what does it mean? And you can respond in a non-judgmental manner so that the child feels comfortable. We cannot continue in an environment where if you ask a question about sex, you're a bad person. I am an adult, I'm a parent. This is not a conversation that is necessarily easy to have, but it is one that we need to have. If you are asked, you have to answer the question. You cannot skirt it. You cannot beat about the bush. We need to be having these conversations in our homes, in our schools, in our religious institutions, on radio. Our children need to be educated. They need to know their rights. They need to know and understand their bodies. They need to know and understand where they can go for support if they need the support. So that's what I would say on the prevention. So that's the prevention
side. And earlier, one of our viewers who sent in a message said that this discussion of child and teenage pregnancy should go beyond prosecution and the need to talk about comprehensive sexuality education. Ghanaians were too quick to reject CSE. Girls need to be empowered about their sexual health. This problem is a major bottleneck. If we must address it in a sustainable way, we need to revisit this matter.
Yes, I agree completely. And I hope this will not just be something that gets said here and that's it, but that those of you in the media houses, those of us who have the power to revisit this conversation, we need to come back to it. Our children need education about sexuality. Avoiding it doesn't help our situation.
So protection.
Protection. So we have the state, so I'll leave the states and Usia to speak about what the state does. There's also the NGO community and what they do. So there's Pearl Haven, there's the ARC Foundation. That's for those of us who live in Accra. I have no idea what happens outside of Accra and the numbers of institutions that are supportive. What we have in Accra is nowhere near enough. Our cases are far more than the support systems we have in place.
You're talking about shelter.
I'm talking about shelters. I'm talking about even just a space where you can go and have your voice heard. I mean, when you've been traumatized, you need somebody to hear you out. As somebody who teaches at a university, I can't tell you the number of times. Sometimes you get an email. I've actually had an email once where somebody said to me something along the lines of, this came from a young man. He has this girlfriend. He wants to have sex with her, but she says something. What should he do? And I mean, if I want to figure out who the student is, I could potentially do that, right? But for me, what struck me was this guy, he's probably been trying to ask somebody this for years. And finally decided I may have said something, I don't know. And so for a month, I kept up this conversation with him, right? About rights, perspectives, views, long-term, short-term. And he finally said, thank you very much, madam. I'm going to have a conversation with my girlfriend. And then I let it go. We need to create spaces. And I'm coming back again to in the institutions around us, in our homes. We need to create spaces for people to be able to speak up. We need to offer support. If somebody tells you that they are going through a violent situation, what's your first response, right? Because if there's ARC Foundation and somebody has the number, but when I tell you about my problem, your first act is to tell me to keep quiet. I'm not going to get the protection that the ARC Foundation offers to me. So in addition to the NGOs, I think it's important that we as individuals begin to be a lot more open, a lot more supportive of people who have violent situations that they are experiencing.
I'm appreciating what you are talking about. I have heard of the stories where women, I'm not talking about girls being abused, women who have been abused in their homes and they are seeking help. And unfortunately, where they have gone to seek the help, they are asked to go back home. And that is where they were abused. So these people have to go and live with the abuser. I can't imagine how that works, but that goes on in this country. The shelters, an idea about how many do we have in this country? I have known of ARC Foundation for years. And then recently, the Pearl Haven. Where else?
In our dreams, I suppose, is where the others are. I mean, there is a state shelter, so, and I'll leave Usia to talk about that. But that's it that I know. So maybe there is something else that I don't know. I doubt that very much. But really, that's what we are down to. This is a country of 30 million. Half of us are female, the other half are male. 30 million. And we can count on our fingers the number of safe spaces for people who are being abused. It's not acceptable. There's just no way we should continue like this. It's an embarrassment, actually. When you have to speak about this, you're embarrassed because frankly, it's a joke. We don't take these matters seriously enough. There are too many people who are in distress and have nowhere to go. And it cuts across income groups. This is not just a poor woman's issue, a poor girl's issue. It cuts across entire income groups, the rich, the poor, young, old. We are all facing this. And we just don't have enough facilities to begin to address it. And then within the facilities, it's also important that, I mean, Professor Piejetra was talking about the law. We need the law, but we need to translate the law into action in a way that works. Too many of our survivors are finding themselves victimized by going through the process. It takes too long, so far as I'm concerned, and I'm sure the lawyers do say this, justice delayed is justice denied. If it's going to take me 5 years, if I'm 12 and I was raped, and it's going to take you up to when I was 17 to put the person behind bars, then what's the point? You need to have a sense that if somebody does this to me, they will not get away with it. It's a message not just for the girl in particular, but for those around her to see that this is something that's taken.
Dr. Ado has been attending to somebody and wants to have your view on what he can do beyond this. He says, my patient was defiled 10 years ago when she was 13 years. It was not reported at the time. Her menses stopped after the sex, and therefore for the past 10 years, she has not had her menses again today. She has also been collapsing frequently since that time, and that's what brought her to me. I have reported to the police, and they are working to arrest the man. The problem now is how she is to fund her health Medicare. The expensive medications, tests, and scans, since both parents are dead. She's 24 now, but could not learn any trade because of the frequent collapsing. It prevented her. Any help beyond the criminal procedures? Is there any way that she can get any help at all financially?
So what's been happening, and I'll say what I know, not as a state person, is that we take these on. So you're either doing it as an individual woman or a bunch of us get together and we do this. And this is just one story. There are thousands like that. There's the psychological, the mental health issues, right? I also know somebody who is psychologically distressed because she also was raped a number of years ago, right? And she's trying to get past it. She couldn't, I'm the first person she told. She hasn't been able to tell anybody in her family. She needs psychological support. Psychological support should not be free. Those who are trained as clinical psychologists need to be paid for their services. We can count on them to volunteer, but we cannot set up a system that requires their voluntary services. There has to be a system of payments for all of this. And we don't have it in our environment. So if this young woman is going to get help, and I mean, Dr. Akoto-Ampah and I can talk offline, but I can't on air point to, this is the number you call for the financial services, because it just does not exist.